The conversation that is going to ensue shortly in Kenya is how we are going to fund our health requirements sustainably. And the biggest thank you we can give to those who have supported us, like PEPFAR, is to figure out, as Kenyans, how we can deal with the challenge of financing, how those who are able can do more to support those who are not able. For the first time in the history of our country, the health plan that we have will not only serve those who can afford, it's not going to serve not just to those who can pay, but for the first time, we want even those who cannot pay for government of Kenya to pay for them to make sure they too can access healthcare. Providing health for government is a constitutional imperative. It is not a choice that we have to make. We just have to figure out how it's going to happen. The health program that we have been running has excluded others. If you didn't have money to pay for NHIF, you didn't have money and therefore you didn't qualify. But under our new plan, those who are indigent, those who cannot pay, the government of Kenya is going to make sure that everybody has a health insurance card and make sure that they can access health. And secondly, we have also in our new plan removed all the exclusions that used to limit access to health facilities by especially those who are vulnerable in our community. Many people would go to hospital and they are told, oh, you know, your card has now exhausted your limit. In our new plan, there are no limits anymore. We have made sure that progressively, as so long as you need medical attention, you will get medical attention. As so long as you need medical treatment, you will get medical treatment. And I want to persuade us as a community of Kenyans to begin to appreciate that this is something we must do together. You have seen how the partnership between the US and the Kenya government and all the civil society and other stakeholders has achieved in the fight against HIV and AIDS. We can do it even more if we have a collaboration between government, private sector, and everybody else in between to make sure that we deliver on our new health plan. As Kenyans know, we've had a conversation around universal health coverage for many years. This time, we have to deliver on it. And I am committed to making sure that we build the collaboration and we build the teams that will enable us deliver on our commitment so that we can truly enjoy universal health coverage in Kenya. Kenya's partnership with the United States of America through the US President's Emergency Plan for AIDS Relief, PEPFAR, is one of these very rare partnerships. Indeed, it is amazing what PEPFAR has been able to achieve. In fact, as I sat here and listened to what PEPFAR has done, and when I went through the numbers and the notes and what has happened over the last 20 years, and looking at what the decision of one person, somewhere very far from us, has changed the course of history and made a deadly pandemic into a celebration today. That today we are celebrating a great partnership. If HIV was what it was, this would not be a celebration. This would be something else. There are many instances in the history of Kenya's bilateral and multilateral engagements where partnerships have achieved tremendous positive change in the form of policies, programs, and projects. On the other hand, there have been fewer instances where such partnerships have translated into direct, personal, visible transformation in the lives and well-being of people in terms of ending suffering, reducing the number of deaths, and prolonging the lives of millions of people who might otherwise have faced high risk of agonizing early death. Kenya's partnership with the United States of America through the US President's Emergency Plan for AIDS Relief, PEPFAR, is one of these very rare partnerships. Today, we are able to look into the future with confidence because we stand on the firm foundation laid in collaboration with PEPFAR over the past 20 years. We are highly grateful to the US government. Ambassador, we are grateful to the US government for their partnership that has changed the fortunes of our nation. Such strong show of solidarity is highly appreciated, and we do not take the friendship and support for granted. Today, therefore, is a day to celebrate our historic achievement under a truly transformative partnership. Thank you very much, PEPFAR, and congratulations for many wonderful achievements. On behalf of the people and government of Kenya, I convey a heartfelt thank you to the American people, to PEPFAR and leadership, and to all the other partners, activists, civil society groups, those who have made this program succeed. A very big thank you to all of you. And your contribution, in whatever small way, in whatever major way, is truly appreciated. We have this success because of the collaboration and because of the partnership. I look forward to working with many of our partners, the US and others, PEPFAR, Global Fund, and other organizations, even as we figure out and as we consolidate our plan on universal health coverage. The number of people living with HIV is about 1.4 million, of which about 1.3 million receive antiretroviral therapy from more than 3,000 health facilities across the country. This number includes over 48,000 children, as well as 55,000 breastfeeding mothers on HIV treatment. For millions of Kenyans, therefore, infection has not only ceased to be an agonizing death sentence, people actually remain productive, living as normal members of our community, free of stigma and enjoying a high quality of life. I was moved by the statements of Edna. I want to celebrate Joyce for what you're doing. When I listen to Joyce here, she deserves a better hand of applause. Joyce, you are a great inspiration. When I see you, I see many. Thank you very much, Joyce. The transformation that we could only hope for 2 decades ago has become a living reality for many households and many people. This was made possible principally through the partnership driven by the government of Kenya and PEPFAR, which continues to extend support directly and also indirectly through the Global Fund. PEPFAR contributes nearly 60% of ART commodities and also provides facilitation for various associated programs. And we are truly grateful. And I speak from my heart on behalf of the people of Kenya. We're truly grateful. There hasn't been, in my almost 30 years of being in politics, there hasn't been a successful program like what we see in PEPFAR. This country lost millions of people in this manner. And for a while, it looked like the HIV/AIDS problem would wipe out much of our productive population, robbing the economy of workers and families of breadwinners. The government faced very serious resource constraints in its efforts to pull back people from the edge of graves, families from the brink of ruin, communities from the cusp of disintegration, and the economy from the verge of collapse. Serious support was urgently needed in order to raise the level of necessary intervention on an effective scale. This support came in the form of the President's Emergency Plan for AIDS Relief, which committed more than $110 billion of American taxpayers' money to the fight against HIV/AIDS in more than 50 countries globally. And it's important for me to repeat it, that President George Bush committed $110 billion of American taxpayers' money to help support millions of people globally. As a consequence, over 25 million lives have been saved and many more HIV infections prevented. In Kenya, PEPFAR has channeled over $6.5 billion since 2004, with the latest allocation being over $346 million for financial year 2023-2024 and $327 million for the year 2024-2025. As a result, and again, let me say, this is American taxpayers' money committed to assist our citizens in Kenya. As a result, there has been a 68.5% reduction in new HIV infections and 53% reduction in HIV-related mortality, accompanied by tremendous improvements in the quality of life of persons living with HIV. HIV-related commorbidities are estimated to cost between Kenya shillings 27 or between 27 and 30 billion annually. And owing to a decline in donor support, the funding gap now stands at $11.7 million. The government is committed to progressively increase domestic funding in order to sustain the gains made so far in partnership with PEPFAR. Over the past 2 years, we have increased our financial injection as government into the HIV commodity pipeline by Kenya shillings 1 billion to prevent supply disruptions. I remember making this commitment earlier this year when we were having a conversation with the Global Fund. Additionally, we are committed to end AIDS, as was said ably by Susan, in children by 2027 as part of our commitment under the Global Fund Alliance. They say in Kiswahili, wakati ni sasa. The time is now to take a strong stand and make up for lost ground for the sake of Kenya's children. We must all commit ourselves to this because our children deserve it. Further, the universal health coverage pillar of our bottom-up economic transformation agenda offers a significant opportunity to effectively address the domestic financing gap in our country with respect to HIV. I call on all the stakeholders to embrace this opportunity and make their contribution to a transformed and sustainable national HIV response as we do it globally for all our health sector.